Can probiotics improve male fertility? Maintaining optimal male fertility involves a complex interplay of hormones, oxidative balance, and overall systemic health. Emerging evidence suggests that the gut microbiome, home to trillions of microorganisms, may influence reproductive function via hormonal modulation, immune regulation, and reduction of oxidative stress. Probiotics, defined as live microorganisms that confer health benefits when administered in adequate amounts, have garnered attention for their potential to improve sperm parameters, enhance testosterone production, and mitigate inflammation. In this video, we present the authentic scientific evidence behind the question, can probiotics improve male fertility? Understanding the gut reproductive axis. The concept of a gut reproductive axis centers on the idea that gut microbes can affect distant organs by producing metabolites, modulating immune responses, and influencing systemic hormone levels. Short-chain fatty acids, bacterial cell wall fragments, and microbial peptides enter circulation and may impact Leydig cells in the testes, which are responsible for testosterone synthesis. Additionally, probiotics can enhance gut barrier integrity, reducing endotoxin translocation that triggers systemic inflammation, an established contributor to impaired spermatogenesis and hormonal imbalance. Mechanisms by which probiotics may enhance male fertility. First, hormonal modulation. Certain probiotic strains upregulate follicle-stimulating hormone, FSH, luteinizing hormone, LH, and testosterone levels, which are directly linked to spermatogenesis and sperm motility. For instance, Lactobacillus rhamnosus Pb01 has been shown in animal studies to elevate testosterone and improve key sperm kinematic parameters like curvilinear velocity, VCL, and straight-line velocity, VSL. Second, oxidative stress reduction. Spermatozoa are highly susceptible to oxidative damage due to their rich unsaturated fatty acid content. Probiotics bolster endogenous antioxidant defenses, such as superoxide dismutase and glutathione, thereby reducing lipid peroxidation and DNA fragmentation in sperm cells. Third, anti-inflammatory effects. By strengthening intestinal tight junctions and decreasing circulating lipopolysaccharide, LPS, probiotics lower pro-inflammatory cytokines, e.g. Illinois-6, TNF-alpha, that can otherwise impair testicular function and sperm quality. Human clinical evidence. Idiopathic asthenozoospermia trial. In a randomized study of men with low sperm motility, asthenozoospermia, participants received a high-dose probiotic blend, Lactobacillus casei, L. rhamnosus, L. bulgaricus, L. acidophilus, Bifidobacterium breve, B. longum, and Streptococcus thermophilus at 2.11011 CFU daily. After 12 weeks, the treatment group showed significant increases in sperm concentration, motile sperm percentage, ejaculate volume, and total antioxidant capacity, along with reductions in plasma malondialdehyde, an oxidative marker, and inflammatory biomarkers. Idiopathic oligoasthenoteratospermia study. Men diagnosed with idiopathic oligoasthenoteratospermia supplemented for 6 months with a combination of Lactobacillus paracasei B21060, arabinogalactan, oligofructosaccharides, and L-glutamine experienced marked improvements in sperm concentration, ejaculate volume, progressive motility, normal morphology, and sex hormone profiles, FSH, LH, testosterone, compared to baseline. Randomized controlled trials. Probiotics in infertile men, Iranian RCT. A double-blind, placebo-controlled trial in 52 men with idiopathic oligoasthenoteratospermia evaluated daily 500 mg probiotic supplementation over 10 weeks. Outcomes included ejaculate volume, sperm concentration, motility, total antioxidant capacity, malondialdehyde, and inflammatory markers. The probiotic group saw statistically significant increases in sperm count and motility, and reductions in oxidative stress and inflammatory factors versus placebo, underscoring probiotics' therapeutic potential in human males. Symbiotic intervention, Familact registered trademark trial. A triple-blinded randomized clinical trial assessed symbiotic Familacta, a combination of probiotics and prebiotics, in idiopathic infertile men. After treatment, the Familact group exhibited significant gains in sperm concentration, motility, and normal morphology, alongside reductions in sperm, lipid peroxidation, and DNA fragmentation index, DFI. These benefits are attributed to enhanced antioxidant status in seminal fluid, suggesting symbiotic formulations may offer synergistic advantages over probiotics alone. Insights from animal models. Animal studies corroborate human findings and elucidate underlying mechanisms. In mice, administration of Lactobacillus rhamnosus improved semen quality and testosterone levels while suppressing pro-inflammatory markers, COX-2, IL-1B, Illinois 6, and oxidative stress, MDA, protein carbonyls. Aging or obese mice receiving L-reuteri ATCC PTA 6475 showed increased spermatogenesis, Leydig cell numbers, and serum testosterone levels, highlighting the probiotic's capacity to reverse age and obesity-related reproductive decline. Compelling evidence from human clinical trials, symbiotic interventions, and animal models indicates that targeted probiotic supplementation can enhance male fertility by improving sperm concentration, motility, morphology, reducing oxidative stress, and modulating reproductive hormones. While probiotics are not a standalone cure and should complement a healthy lifestyle and any prescribed fertility treatments, they represent a promising adjunct for men facing idiopathic infertility or those recovering from varicocelectomy. As research evolves, clinicians and patients alike should consider integrating well-characterized probiotic strains into comprehensive fertility support strategies.